Carah, where else do you see, or how do you see this crisis of care unfolding in our nation or in the world today?
I feel like in a lot of places, there's a big dichotomy, right? Because especially with the kind of the research and the growth of like anti-obesity medications that are out there now, feeling more comfortable saying, oh, I don't like this, so I'm going to take this medication, and saying it loud. Kelly Clarkson, came out saying that she was doing it, and Oprah, and everyone at the beginning was like, oh, that's so great, we're talking about this. But unfortunately, I fear that we're talking about it in the wrong way. And a lot of the conversation and that narrative is still being tied to the cosmetic piece of it, right? Because any Tom, Dick, and Harry right now can prescribe these OMMs that are compounded or whatever. They're popping up everywhere. And so people are taking them, not because they have the disease of obesity, but because they don't like how they look in the mirror, which is part of the narrative that needs to shift, right? To really emphasize that what we're treating is not the mirror. We're treating a disease process, something on the inside. And also, we're not just going and taking a medication or having a surgery, because that's where I feel like kind of grows that narrative that this is a shortcut. And that's not what we're doing. If you're going to a practice that has an obesity medicine program, that has providers that are educated in the disease of obesity, you're not just going and getting a prescription or filling out a form and getting something mailed to you. You're having nutrition education. You're probably seeing a psychologist. You're probably incorporating sports medicine, because we recognize that as that weight's going down, right, that's changing the way that your body is dealing with nutrients, changing the way that your body is processing those nutrients. It's burning muscle here. It's not necessarily burning fat. So I feel like that it's a mixed bag in terms of, what that has brought in terms of being able to talk about, maybe I don't want to live in a large body anymore. That's not what obesity is. So it's a very frustrating situation, I think, for a lot of us that are really advocating for a change in the understanding of what obesity is. People are losing all this weight. Their skin looks like it's falling off. Muscle kind of looks like it's sagging. I've had patients that have come in, we look at body composition in my clinic. And I've had patients come in that have lost a significant amount of weight, right? But when we look at it on the body composition side, that visceral fat, which is what we know is the fat that's surrounding those internal abdominal organs, leading to those additional disease processes, has either stayed the same or gotten higher, and their muscle mass has gone down. So congratulations, you're wearing a different size, but you're not healthier.